behalf of the Bermuda Police Service. Also, Senior Program Manager at the Department of Child and Family Services, Ms. Renee Brown, and the Morocc Committee members, Mr. Damon Wade, Co-Chairperson of Center Against Abuse. As initially highlighted in the 2022-2023 throne speech, Bermuda is implementing the Morocc, which is the Multi-Agency Risk Assessment Conference model. A Morocc is a regular meeting to discuss how to help victims at high risk of serious harm in domestic situations. It is a confidential meeting where attendees will discuss the victim and share relevant information in order to support and protect the victims and their families. Together, the meeting will put together a risk management action plan, individualized for each victim, so that each agency is aware and understands their role in protecting and supporting the victim. The participants in a Morocc are police, the Vulnerable Persons Unit, Department of Child and Family Services, support services such as Center Against Abuse, Women's Resource Center, Aging and Disability Services, health where necessary, other relevant agencies who have knowledge of or works with the victim or family, such as court and probation services, mental health services, substance misuse services. Since 2022, we have undertaken a comprehensive review of our systems, aiming to improve our response, early intervention, and prevention of domestic abuse in our community. This review was conducted by Safe Lives UK, an organization charity dedicated to ending domestic violence that works with organizations across the UK to transform the response to domestic abuse. Safe Lives took a systems-wide assessment of our current landscape, engaging with various stakeholders, including survivors, perpetrators, professionals, and the general public. They used a range of methodologies, including public surveys, face-to-face interviews, and consultations with service users and providers. Through this collaborative effort, we have gained valuable insights and identified key opportunities for improvement. The Safe Lives Bermuda Public Health Approach Report, published on www.gov.bm via the Ministry of Social Development and Seniors webpage, includes the following content: prevalence of domestic abuse in Bermuda, the systems in Bermuda, domestic abuse awareness, multi-agency working, governance and information sharing, referral pathways, support services and commissioning, working with those who harm, the whole family working, the authentic voice, risk assessment and Morocc, and summary of recommendations. One of the most significant outcomes of this review is the establishment of a domestic abuse strategy for Bermuda. Today, I'm proud to share with you the priorities for 2023-2024 period, which will guide our efforts in addressing domestic abuse. Priority 1, the establishment of the Multi-Agency Risk Assessment Committee, Morocc model. One of the significant advancements is the establishment of the Multi-Agency Risk Assessment Committee, Morocc, in Bermuda. This committee will regularly review the high-risk domestic abuse cases and bring together core agencies such as the Bermuda Police Service, the Center Against Abuse, and the Department of Child and Family Services, along with other specialists when necessary. The Morocc will provide a vital platform for sharing information and expertise. The Morocc has convened meetings to review cases. Priority number 2, implementation of a multi-agency information sharing agreement. To support the Morocc process, we will implement a multi-agency information sharing agreement. This will facilitate the information of sharing between agencies, enabling a more coordinated and effective response. Priority 3, increasing domestic abuse awareness among professionals. We are committed to increasing domestic abuse awareness amongst professionals, ensuring they have a shared understanding and language when addressing domestic abuse. It is crucial that survivors feel believed and supported when seeking help. We will develop a clear pathway and flowchart for multi-agency workings, ensuring a coordinated response. We will also look to work with agencies to commission perpetrator services to create programs that are robust and risk-focused. Priority 4, engaging political partners and strategic leaders. We will actively engage our political partners and strategic leaders to raise awareness about domestic abuse and make it a key priority. By fostering awareness, we can secure the necessary resources to effectively tackle this issue and create lasting change. Priority 5, specialized police training. Recognizing the critical role of the Bermuda Police Service, specialized training to increase police awareness of domestic abuse will be provided. This will improve survivor experiences when seeking support, and the Commissioner of Bermuda's Police Service will provide further details shortly. Priority 6, shared standard risk assessment tools. We recognize the importance of consistent risk assessment in domestic abuse cases. Therefore, we will implement shared standardized risk assessment tools across core agencies. This will ensure a unified approach to assessing the level of risk and inform appropriate interventions. Priority 7, improve data collection. Enhancing our data collection efforts is essential in addressing domestic abuse. We will work closely with core agencies to improve data collection surrounding domestic abuse instances. This will enable us to monitor trends, measure progress, and make data-informed decisions. Priority 8, review of agency policy and procedures. We will conduct a thorough review of individual agency policies and procedures, aligning them with the Bermuda Domestic Abuse Strategy and the Morocc. This alignment will ensure a cohesive approach and effective collaboration amongst agencies. Priority 9, support a domestic abuse specialist. We will implement a process whereby survivors are supported by a single specialist domestic abuse professional who can identify needs and coordinate support from other agencies. And priority number 10, public awareness campaign. To raise awareness island-wide, we will continue to launch a comprehensive public campaign. This campaign will inform the public about available support services and instill confidence in professionals' responses to domestic abuse. These are just the first 10 priorities of our comprehensive domestic abuse strategy for Bermuda. Each one plays a crucial role in improving our response to domestic abuse and creating a safer environment for all members of our community. For anyone who is experiencing domestic violence, we want action before someone is harmed or harms others. Harmful behavior identified and stopped. We want increased safety for everyone at risk, as well as the ability for people to live the life they want after harm has happened. Bermuda, our response to domestic abuse is vital, and I will highlight a few statistics that we should all consider. Bermuda's estimated adult female population is 27,723, according to the 2016 Bermuda government census. Research from the World Health Organization estimates that 1 in 3, 30% of women globally have been subjected to either physical and or sexual intimate partner violence or non-partner sexual violence in their lifetime. 20% of women aged 15 to 49 reported they had experienced intimate partner violence. Furthermore, WHO estimates that globally, in a 12-month period, 13% of the female population will have experienced intimate partner violence. Based on this research, we estimate that 27% of the female Bermuda population will have experienced intimate partner violence or abuse at some point in their lifetime. The 2016 census data, therefore suggests that over 7,000 women in Bermuda have experienced intimate partner violence in their lifetime. We further estimate that over 3,000 women in Bermuda have experienced intimate partner violence in the last 12 months. Male victims, while domestic abuse is a gendered crime and the majority of victims worldwide identify as female, we know that anyone, regardless of their sex, gender identity, sexuality, disability, or age, can experience domestic abuse. Therefore, we know that there are male victims of domestic abuse in Bermuda. However, there is no global estimates of male victims. The England and Wales Crime Survey usually returns around 3 to 4% of men and 7 to 8% of women experiencing domestic abuse in 1 year. This is worked out at between 13 to 14% of men experiencing domestic abuse over their lifetime and 27 to 28 of women over their lifetime in England and Wales. To fully capture the gender breakdown in Bermuda, we recommend that domestic abuse services and statutory agencies collect and monitor detailed case data. To support male victims, it is key to understand their needs. Male victims face barriers in seeking support for various reasons related to stigma. Safe Lives is conducting research into the experiences of male victims and the best ways to support them. On behalf of the Bermuda government, I would like to thank the Morocc members, Bermuda Police Service, Safe Lives UK, all the stakeholders in government and private sector who have contributed to this survey and initiative. I want to thank you for your dedication to this vital cause. Now I will invite the Commissioner of Police to elaborate on the specialized training and initiatives that will be undertaken in support of our domestic abuse strategy.
Good morning, or rather, yes, good morning. Survivors of domestic abuse often face significant challenges when seeking support, including fear, shame, and uncertainty about how to access resources. Police officers play a critical role in responding to incidents of domestic violence. But historically, our response has not always been effective in protecting the survivors and holding abusers accountable. To address this issue, the Bermuda Police Service officers have been undergoing training in keeping with guidelines set out under the Multi-Agency Risk Assessment Conference that focuses specifically on domestic abuse and its impact on survivors. This training covers a range of topics, including the dynamics of domestic abuse, the psychological and emotional effects on survivors, and strategies for responding to incidents of domestic violence in a way that prioritizes survivor safety. One key aspect of this training is helping officers recognize the signs of domestic abuse and understand the different forms it can take. Domestic abuse can involve physical violence, sexual assault, emotional abuse, financial exploitation, and more. By understanding the breadth and complexity of domestic abuse, officers can more effectively identify situations where survivors may be at risk and take appropriate action to protect them. Another important component of this training is helping officers understand the impact of trauma on survivors of domestic abuse. Survivors of domestic abuse often experience significant psychological and emotional trauma, which can affect their ability to trust others and to seek help. By gaining a deeper understanding of trauma and its effects, officers can be better equipped to support survivors in a way that is compassionate, respectful, and trauma-informed. Ultimately, the goal is to improve survivor experiences when seeking support from law enforcement. Increasing police awareness of domestic abuse and providing officers with the tools and knowledge they need to respond effectively means survivors can feel more confident in seeking help and getting the support they need to move forward. This also strengthens the relationship between law enforcement and the communities we serve, creating a safer and more supportive environment for all. Thank you.
We have a growing number of mental health challenged individuals. I heard nothing in this press conference that addresses those challenges that bring this element to the jail. How do you tackle that?
Sure. So mental health conditions would be prevalent in almost any sort of social condition or issues. This Morocc team is a team or model that addresses domestic abuse it does not go without saying that we will not encounter mental health issues. And of course, we will liaise with mental health agency. I did report that part of the Morocc team is pulling in those agencies when it does come to mental health. And so we are committed to include those agencies when necessary.
Sarah Nagan from the Royal Gazette. We've heard a lot about the support for the victims in the press conference. How about preventative measures for people, the perpetrators?
Sure. And I'm glad you raised that, because that is definitely a gap that we do have in our system and in our services as far as services available for perpetrators. And I did mention that being one of our priorities in making sure that we are helping to close that gap as far as providing resources for perpetrators so that they can also receive the help that they need. I did mention also about the priority as the domestic violence specialists, who will also be helpful to perpetrators as well.
Okay, great. Do you have any specific goals and timelines with this program?
So I did mention that the time frame is for the 2023-24 period. So these are priorities that we will be working on this year. That
and
year.
In terms of goals, I mean, are there statistics that you would like to reduce domestic violence by this percent, or any
So the agencies that are collecting data, of course, the police have a bit of data in regards to domestic violence, correct me if I'm wrong, calls that occur in our community, and the Center Against Abuse also collects data as far as services and calls that they receive in their response to domestic abuse. So there is data that exists. Of course, as a country, as a community, we want to reduce the instances of domestic abuse, and that's why we are moving forward with this Morocc model to be able to support persons in our community and do this with a collaborative approach. And that's the whole sort of premise behind the Morocc model.
Yeah. Can you allude to what kind of resources are being dedicated to this from the government, from the police, and all the agencies?
Sure. So I have a whole team of people behind me who are dedicated to helping with the domestic abuse response and providing support to persons in our community. This is not a new issue. This issue has lasted globally in Bermuda for many, many centuries and years. And so this is something, I don't want our community to think that this is something we're working on initially and that it goes away. This is a constant issue that we will have to continue to tackle. And so that, we want to make sure that we have systems, models in place to make sure that we're keeping our finger on the pulse.
And monetary value on
monetary? Yes. So I did speak to, and maybe Commissioner can speak to Bermuda Police Services resource, but we spoke to the domestic violence specialist. So we've put aside about 90-something thousand to this cause. And we also provide a grant to Center Against Abuse yearly in the amount of $150,000.
So we have a dedicated domestic abuse officer, and obviously the entire team of the VPU Vulnerable Persons Unit that are dedicated particularly to investigations as they go on. But specifically for the support, we have a single domestic abuse officer, and we're looking to grow that number as the numbers within the organization increase.
Okay, just one more question. So you talked about data collection and sharing data. Obviously, there was probably privacy issues that you need to consider.
Sure.
Can you talk about that?
Absolutely, because I did speak to information sharing. Of course, information, that's all part of the agreement, because consent will have to be gathered, and we take that very seriously. And also the regulations surrounding PIPA as well. So confidentiality, consent, and also being regulated by PIPA. I do want to take this opportunity to have the community to read the Safe Lives report. A lot of work went into this document. I would like to say that it is a very authentic document definitely hearing from the perpetrators perpetrators and survivors, and getting a real idea of what our community is experiencing.
Commissioner, I'm going to ask you a question. Is your officers training that will help to diffuse a situation, especially in the middle of a argument, domestic abuse situation, that it doesn't bring harm to the perpetrator that might be irate at that time?
Yeah, so officers are generally trained to de-escalate situations. What's going to change around our domestic abuse training is really sort of sensitization around the factors that impact around domestic abuse, how to recognize signs of abuse better, and really sort of standardize our response. So we're developing, for example, checklists of questions that officers have to ask, things that they will have to particularly take note of and report back so that we can really standardize our response. One of the issues, because we talked about, you asked a question about numbers going down. I actually want to put out there very clearly that I am hopeful that we see the amount of reported numbers go up. Because the reality is, with domestic abuse, is very much a hidden crime issue, and it's people develop more confidence in their policing service, in their reporting agencies, that people who are currently experiencing but not reporting develop the confidence to report. So very often when you see law enforcement agencies dedicate efforts to particular issues in the community, you see those numbers rise as confidence increases. So one of my specific aims really is to increase the confidence so that when there's somebody who's experiencing a negative situation, they feel like, hey, I can call 911 and the service that we deliver inspires them, and they just feel confident in that. And we're consistent in how we deliver that service.
All right, thank you. Thank you, Minister.
Thank you.
Please, Commissioner, that concludes our press conference.
Thank you.